this session is aimed at overseas doctors, so international doctors who have gained their medical qualifications outside of the UK and are looking to join the GMC register or potentially already joined the GMC register and hopefully start either working in the UK or hoping to start work in the not so distant future. I can see already a couple of comments and questions coming through, so I would encourage you to use the chat box, ask any questions that you may have as we go through the session, whether they relate to the slides that we are talking about or whether they are covering any other issues. Happy to talk and try and answer any questions that you may have. The first couple of questions, unfortunately, I'm not going to be much use with, I'm afraid. So the first question we've received is, what's the best job for an international medical graduate, or what's the best first job for an international medical graduate? And unfortunately, at the GMC, we don't provide advice on sort of careers and the best route into work. But what I can say is, it very much depends on the level that you are at as an international medical graduate. Depends on the experience, when you graduated, what you've been doing since you graduated. Lots of different things that you need to consider, and it is very much a personal, individual decision for you. There are things such as locum agencies in the UK who are able to find work for doctors. Many trusts across the UK run international recruitment schemes. So I would really suggest thinking about where you want to work in the UK, thinking about the level that you are currently at as a doctor and how that translates to working in the UK. And then doing some research around the hospitals and trusts in that area, and perhaps some of the recruitment agencies, locum agencies in those areas. So that would be my advice in terms of a starting point. But unfortunately, we don't really provide much more advice around starting work. What I'm going to do is talk you through a program that we run for international medical graduates, and I'm going to give you a brief overview of the program and explain what we do and why we do it. And then if we've got time, I'm just going to run you through some of the bits of information and scenarios that we would cover during the session. So again, another question coming through. Nope. So question there from Maria. So to be an international doctor, do I need to learn another language? So as long as you can speak English, if English is your first language, you are likely to have to complete the English language test. But if English is your first language, it shouldn't cause you any problems. And certainly in terms of working in the UK, joining the GMC register, there are no requirements that you speak a second language. We just require that you are able to speak English. Because when we talk about international doctors, doesn't really matter what your nationality is. It's about where you gained your medical qualification. So international medical graduate is just a doctor who has gained their medical qualification outside of the UK. And we are finding more and more so that there are doctors who actually are from the UK, are UK nationals, but they've gone overseas and they've gone to medical school in different countries around the world to gain different experiences and they have gained their medical qualifications overseas, and they are still classed as an international medical graduate even though they are UK nationals. So it doesn't matter about the language really, as long as you can speak English, as long as you can pass the English language test, that is what matters really. So the Welcome to UK Practice session is a workshop that we run for doctors who are new to the UK. So doctors who have worked overseas, have gained the medical qualification overseas, and I've decided to apply for registration on the GMC register and looking to start work in the UK. See a couple of questions. One more question. I will come back to that shortly. I'll answer it now because it's quite. So, do I need to take any tests if I want to be a doctor in the USA or Canada after graduating in the UK? I can't answer that question. To be honest, I'm not sure what the rules and regulations are in terms of working in other countries. If you graduated in the UK, you can join or you can apply to join the register on a provisional basis as a foundation year 1 doctor, and that would be the process that you would follow in the UK. But in terms of sort of looking to go into another country and work, all countries have different requirements and different regulations, so unable to give any advice in that area, unfortunately. So, bit about me. Who am I? Why am I sat on my laptop talking to you on a Saturday afternoon? So I'm part of the GMC Regional Liaison Service. You can see my picture there at the very top left-hand side of the map in front of us. This is just a map of England. You can see my colleagues spread around England. Also got colleagues working in Scotland, Wales and Northern Ireland. Basically, my role at the GMC is to go out and meet with medical students, meet with doctors of all levels, and to talk about the roles of the GMC, to increase doctors' awareness of our guidance and how it can help and support you on a day-to-day basis. So part of my role is delivering Welcome to UK Practice sessions, which I say are aimed at international medical graduates. So the aim of Welcome to UK Practice, and these are half-day workshops, which I'll run through shortly, but the overall aim of the workshops that we run are to ensure that doctors new to practice in the UK have a better awareness and understanding of GMC guidance, because this will assist you in practicing in a manner that protects patients. So it's very much introducing you to the GMC, introducing you to our guidance, and helping you understand and think about how the guidance can assist you in your day-to-day practice. So very useful session, I think, and I'll show you some of the feedback that we received. But I would encourage you, if you are already in the UK and you haven't attended these sessions, or if you are looking to join the register, then certainly attending one of these sessions is helpful. So we'll start by saying it is a free workshop, so we don't charge any doctor to attend any of our workshops, and it is aimed at doctors who have gained their primary medical qualification outside of the UK. Now, the workshop focuses on the roles of the GMC and gives you a good introduction and a good understanding of the different roles that we have. It introduces you to our ethical guidance, and we watch different scenarios and different case studies and just talk about how the guidance can assist you in your role. We also hear from other doctors who have been on the journey that you would be on. So doctors who have joined the register and started work in the NHS, they're reflecting back on their problems and challenges that they face. So not only in just working in the NHS and working as a doctor in a different country, but also just the challenges of moving to a different country and learning to adapt to the different cultures and behaviours in a new country. So quite a useful video of doctors reflecting on those common challenges. We introduce you to reflection, and we encourage you to reflect throughout the workshop and think about how you can continue to develop it and learn to improve your practice. And I think the last two bullet points there are perhaps the most important bullet points, but unfortunately also the bullet points that are much more difficult to achieve at this moment in time. We're in the middle of a pandemic. we are in the UK lockdown again for the next 4 weeks, but for the last 8 months, we haven't been delivering face-to-face workshops. We've been delivering workshops virtually like this, and that makes networking much more difficult because previously we would have got a group of doctors together in a room, as you can see from the 2 pictures on the slide, and that gives you the opportunity to meet with doctors who are in a similar position to you, to share experiences, to make contacts and friendships with other doctors who may be working in similar areas to you. So that's something that we have lost during the pandemic, but we still do try and give you the opportunity to meet each other virtually and share contact details if you wish to do so. And obviously the final point is something that we are unable to do at the moment. So that GMC face-to-face contact. Now, that's my favorite part of my role. Getting to meet and talk to doctors on a face-to-face basis. Again, that's something that we are unable to do at the moment. We have replaced it with these virtual sessions, but it isn't the same as meeting face-to-face. But it still does allow you the opportunity to ask questions and discuss things with the GMC in a way that you may have not previously had the opportunity to do so. And then you also get access to online self-assessment tools, so you can access these tools and just increase your own knowledge and understanding of the GMC guidance. So would really encourage you to look at these workshops. So the reason that we run the workshops is the numbers, really. So if we look at the numbers here, this is just how many doctors there are on the UK medical register. So if we look at the top left-hand side of this slide, there are just over, well, at the time that these figures were taken, there were just over 310,000 doctors on the medical register. It's actually now increased to just over 330,000. But if we break that down, so if we look at the box underneath that number, we're looking at the number of doctors on the register who have graduated outside of the UK. So of the 260,000 doctors who hold a license to practice, which allows them to work in the UK, 65% of those doctors graduated in the UK. And that obviously leaves us with 35% of the doctors who have graduated outside of the UK. So they are huge numbers. So if we add those together, if my maths is correct, that's just over 100,000 doctors on the GMC register who gain their medical qualification outside of the UK. So it's really important that we give those doctors as much support as we can, because you are facing different challenges and you are trying to understand the different ethical scenarios that you may be faced with when you start work in the UK. So, really important that support is available, and for all of those doctors who are joining the register, having gained their qualification overseas, we're trying to ensure they attend these courses in order to start you off in the right place and give you that understanding of the GMC guidance. And what that actually means is, so we look at those numbers, is that doctors who may be on this session who are currently overseas and are working overseas, currently overseas and have gained your medical qualification overseas and might be thinking about coming over to the UK and applying to the GMC register, what those numbers tell us is that we are reliant on doctors who have trained overseas and then make the decision to come and live and work in the UK. So you are extremely welcome, and we have doctors from all over the world. So hopefully on this slide you can see a greeting, a welcome from the part of the world that you are joining us from or have previously lived or worked in your lives or careers. But we are reliant on doctors making that decision. 35% of the doctors working in the UK, as I say, have gained their qualification overseas. So vitally important that we continue to give you as a group of doctors as much support as we can. So the sessions as we're running them now look a bit like this, very similar to how we are running a session today, really. We show you some slides, we have videos so you can see and interact with us. We use a chat function, so very similar to what we are doing today, and that allows you to talk to us, it allows you to ask us questions, but it also allows you to talk to each other and share experiences with everybody else who is on the call. We try and make the session as interactive as possible, so we give you different scenarios, we ask you to vote on those scenarios, so it gives you the opportunity to answer questions anonymously, and then we talk about the answers that we've been given. So very much an interactive session which is trying to allow you to get the most out of it. So received lots of good feedback from doctors who have attended. So this is a bit of a sales pitch, really, that 99% of the doctors who have attended have rated it as good or very good. They would recommend it to a friend and they feel like it's improved their knowledge. And 96% of those would change the way in which they currently practice. So it shows you that the course is very well received by those that attend. And actually, nearly 75% of the doctors who have attended the online course feel like it works well. So they would choose online over face-to-face. And that does open up more options for us because it allows doctors to join from anywhere in the world. And this morning I was actually running a Welcome to UK practice session. It started at 10 o'clock in the UK. And we had doctors from all over the world, from India, Pakistan, Nigeria, Saudi Arabia, all over Europe, who join in the countries that they are currently based in. And it opens up much more easier lines of engagement, I think. And the feedback that we've received. So again, just showing you some of the positive feedback that we have had from the doctors who have attended, and it's helped to signify that the role of teamwork and making tricky decisions, and also that the exercises are amazing. It's not just a lecture, so it certainly shouldn't be just sitting and listening to somebody from the GMC talk, which is kind of what you are doing at the moment. So you can go on to the Welcome to UK practice area of our website. You can look at the different guidance and case studies that we've got available, and you can start increasing your knowledge and understanding of our guidance already. So if you are thinking about coming over to the UK, if you have recently come over and started work, then please do have a look at the website to help increase your knowledge and understanding. Because what the guidance does is, as we talked about, it focuses on introducing you to our standards and on our guidance that we have in place. So this is just a selection of those pieces of guidance. So we've got good medical practice in the middle there, which is our key piece of guidance. It underpins all of our other areas of work. But then we've got some really detailed areas such as confidentiality. We've got decision making and consent, which I talked about earlier. And then we've got other bits of guidance that just support particular areas. So like to highlight the one on the right hand side, where we try and ensure doctors are well aware of the expectations in terms of your use of social media. So I'm going to try and make it a bit more interactive now. I've been talking for the last 20 minutes or so, and I just want you to think about really what makes a good doctor. So if you are doctors on the call, if you are thinking about a career in medicine in the future, if you are already working in the UK, perhaps thinking about coming over to the UK, what do we think makes a good doctor? So let me know in the chat function any words that come to mind. So we've got practice, experience, compassion. Some good points that we're raising. Anything else? What if you were a patient? If you were empathy is a key one, I think. If you were a patient and you went to visit the doctor, if you had an appointment with a doctor, what would you expect from that doctor? What would you be looking for as a patient? Yeah, so dedication and people skills, kindness, absolutely. When we say people skills, what does that mean? How do we display good people skills? Yeah, professionalism, absolutely. Commitment. Anything else? There's one key area that I think we're missing here. What do you expect as a patient? What do you think your patients expect of you? Something that you will be doing with your patients every time you see them. Trustworthy, I think, is another good one. Yep, so making patients' needs your first concern. Straight out of good medical practice, patient-centric, making sure the patient understands. So I think the point there from Anika is probably as close as we're getting to it. So being friendly, open, and explaining things in normal terms. So I think what we are thinking about there is communication. So yeah, not using too difficult terms and language. It's about how we communicate with our patients. And what we did at the GMC a couple of years ago now, we carried out a survey where we emailed a number of members of the public or patients, and we asked them what do they think makes a good doctor, and we gave them the opportunity to simply reply to us in an open text box. So it was they could just reply with whatever words they felt that made up a good doctor, and these are the responses that we received. So the bigger and bolder the response here, the more often it was said in the survey that we carried out. So if you look at some of the key biggest words there, we've got listens as being the key word, and I think that is absolutely vital, really, that you listen to your patients and you listen to your colleagues at all times. We've got communication, understanding, respect, colleagues, care, ability, compassion, empathy, and sympathy there. So what I get when I look at those words is that they are very much the sort of your personal skills, those interpersonal skills that you've got that allow you to interact with a patient and communicate and listen to your patient on a day-to-day basis. We mentioned sort of competence and skills, and they are on the left-hand side there. We've got skills, knowledge, competencies, but they're not as big as you would perhaps expect, I don't think. I think they obviously were said by the respondents, but nowhere near being the most popular response. And I think actually, certainly in the UK, if patients go and visit the doctor, I think they take for granted the fact that you have the required skills and the required experience and the competencies to be working as a doctor and to be treating that individual patient. I certainly, I'm not a doctor, and I think of my own experiences as a patient. Actually, my wife has been through some quite serious treatment during the lockdown period in the UK. She was seeing consultants, she was seeing other doctors and nurses, and at no point during the period she was being treated did we ever go onto the GMC website and look for the doctor. Did we ever question the doctor's experience or knowledge? I think we take for granted that the doctors working in the UK have that level of ability and knowledge and experience. And what separates the experience and makes a good doctor are those interpersonal skills that we are thinking about. So certainly, if you're already working in the UK, bear that in mind. And if you're planning to come to the UK in the not so distant future, just do think about those communication and interpersonal skills once you start work. And I think a lot of the words that we saw there, I think, link to trust really, and trust plays an absolutely vital role in the doctor-patient relationship. It underpins that relationship, I think. And there is a company in the UK who carry out a survey every year. So opinion polls, and they basically go out to the public and they ask the public, who do you trust the most and who do you trust the least in terms of professions in the UK, and come up with a league table, if you like, of the most trusted and least trusted professions. So do we think doctors are one of the most trusted professions in the UK? I'm going to show you the top 6. Do we think doctors are likely to be in the top 6 of the most trusted professions? Anybody want to guess if doctors are going to be one of the most trusted professions? So we've got our first yes. Anyone else want to agree or disagree with Sonali? So absolutely, doctors are on there, number 2 on the list, and obviously it would be quite strange of me to sit talking to a group of doctors or potential doctors and talk about the importance of trust, and then you not appear on this list of the most trusted professions. So you are there, number 2 on the list, actually. Who do we think might be more trusted than doctors? So doctors historically were always number 1 on the list, and then a couple of years ago, a different profession was introduced to the survey and have taken over the number 1 spot for the last couple of years. Somebody who you work quite closely with. So it's actually nurses. Nurses have overtaken you at the number 1 spot, and now the most trusted profession in the UK. But I think you just look at nurses and doctors up there. What that tells me is that the medical profession have the highest level of trust from the public in the UK, and patients come to you and they will share information with you. They will talk to you about issues that they've never talked to anybody else about in their lives. So, they will share information with you that they've never told their husband or their wife or their sons or their daughters, but they come and share that information with you as a doctor because they trust that you are going to keep that information confidential, and they have that high level of trust in you. So we're just going to turn it round now and look at the least trusted professions in the UK. So thinking about those professions who aren't very well trusted, I won't ask you to guess these, I'll just flash them up. This list just makes me feel quite depressed, to be honest. When we look at government ministers, politicians, journalists, extremely important people making, particularly at the moment, extremely important decisions about how the pandemic is being managed in the UK, and the level of trust in those individuals, is nowhere near as high as it is for you as doctors, and just bear that in mind as you progress in your career. Now, some of you may currently be living abroad, and you may be thinking about moving over to the UK at some point in the near future. Some of you may have recently moved to the UK and might be thinking about renting or buying property in the future. So I'm just going to highlight that estate agents do appear on this list. Now, I don't know any estate agents personally, so I'm not going to make any judgments about them as a profession. But when you are looking at those properties to rent or buy, maybe make sure that you ask a few extra questions and get all the details that you need before you sign any contracts. So I've talked about the GMC guidance and the importance of using the guidance, and this is really why we say you need to follow the GMC guidance. And first and foremost, it's just giving you broad principles of good practice. So it's not telling you how to manage every single individual scenario that you find yourself in. It's just giving you those high levels of broad practice that of high level broad principles that will allow you to practice in a good and a safe way. I think the second point down is extremely important for doctors who have gained their medical qualification outside of the UK. You can be sure that if you follow the GMC guidance when you are working in the UK, that guidance is ethically based and is consistent with the law in the UK. So you don't have to worry about reading up on different areas of law and legislation. You can be sure that if you follow the guidance, it is consistent with UK law. The guidance obviously gives you scope to exercise your judgment in applying the principles in each individual case that you will be dealing with. And then finally, if you seriously or persistently fail to follow the guidance, it is likely to result in action being taken. And first and foremost, that will be by the employers and the organisation that you are working in, but potentially eventual referral to the GMC. So we are just going to very quickly now look at some of the examples that we would use in Welcome to UK Practice, and it's going to talk about how these work and how you would deal with these types of scenarios if you found yourself in them. And we're just going to look at one specific case, and I'm just going to reshare my screen with you because I don't think I had the audio switched on, because it's going to be a video that we play. So this is a fictional hospital that the GMC have created to help doctors think about putting our guidance into practice. And the case that we are going to look at now is the doctor here on the left-hand side of the screen, called Dr. Underwood. Now, Dr. Underwood is treating a patient called Andrew, who looks like he might have been involved in some violent crime. And at the end of the scene, a couple of police officers come along and they start asking the doctor questions. So I just want you to put yourself in the doctor's shoes here and think about how you would manage this type of scenario. So I'm going to play the video now. Hopefully you are all able to hear the video and there are no problems with that.
So how did you get into this mess?
Yeah, you don't want to know. It's just going to take long. I've got to go.
I'll be done as quick as I can, okay? It's going to need quite a few stitches.
Thank you for taking the time to talk with us. I'm Detective Sergeant Taylor. This is Constable Rhodes.
Hi.
We're going to need the names and addresses of any young white men aged around 17 to 22 who have been treated for injuries consistent with being involved in a fight.
We're investigating the death of a man in a gang-related violent incident. We believe it happened about 3 hours ago, so we need the details of anybody admitted within that time.
You must understand the severity. We need a lead.
Okay, then what do people think about this type of situation? You are a doctor here working in A&E and you are faced with two police officers who have come along. They've asked you quite a specific question. They have asked you for a list of all patients who have been admitted to A&E in the last 3 hours who meet quite a generic description, but they are telling you they need that information because they are investigating a potential murder. So if you're the doctor in this scenario, do you think we are going to share this information with the police? What would we do in this situation? And what are the issues that we're thinking about? What are the major issues we're faced with here? Just pop some comments into the chat box and let me know what we're thinking in terms of this scenario. Absolutely. So we are thinking about patient confidentiality here. This is the big question that we are asking ourselves. So yeah, around data protection, but about that information that patients give you. So that patient confidentiality, that is absolutely key, and comes back to the issues that we were just talking about the trust that the public have in you. So the public have that level of trust in you as a doctor, because they know that they can give you information and that you will maintain their confidentiality. So that is absolutely key. So what do people think about breaking patient confidentiality in this type of situation? Do we have to, because we're faced with 2 police officers, do we have to break patient confidentiality? Do the police have the right to come and request information from you as a doctor? And there are no right or wrong answers here. I'm not judging any of the answers that you give me. This is just to get you thinking about the sort of situations you may find yourself in. So Anika said we don't think so. We're not sure, but we don't think we should be sharing this information. Abdullah Mir has said nope, that we shouldn't. And I think that is the starting point here. If we really good point from Sonali there, that we would want to be speaking to our seniors, really. Whatever situation you find yourself in here, you want to be speaking to your colleagues and getting some advice from your colleagues. Yep. So the police don't have the right to insist that you break patient confidentiality. Yeah, and a good point there. So you can go to hospital for an overdose and NHS won't tell the police. And that is a good example there, that patients come to you as a doctor and they get treated by you because they trust that you will keep the information about them confidential. And if all of a sudden we start breaking patient confidentiality, start undermining that trust that patients have in you, and patients will soon stop coming to the doctor for treatment, and they will perhaps suffer at home, and their conditions will worsen because they are worried about sharing information with a doctor. And that is certainly a key aspect of this type of scenario. So we've got, you must abide by the law, but don't they need a permit? So yeah, and we're thinking about a warrant there. So absolutely, we'll come on to those points in a second. Good point again from Sonali, that we've got to think about the wider public, and is this patient a potential threat to the wider public? What I would say, so the question that the police asked, I think, was too generic. So they were asking for a lot of information. They were asking for a list of every patient who's been admitted to A&E in the last 3 hours who meet quite a generic description. Now, think about myself. I'm based not far out of Manchester city centre, and if I went into a city centre hospital on a Friday or Saturday night, I'm pretty sure that most of the patients in A&E would meet the description that the police have given you. So you potentially break in a large number of patients' confidentiality if you choose to give the police that information. So I think initially we should be saying no, and we should be seeking support from our colleagues asking for a better description of the individual involved, and that's going to help us make a decision. But the guidance that we are thinking about is the GMC confidentiality guidance, but also more importantly, we've got specific guidance about confidentiality in terms of reporting gunshot and knife wounds, because unfortunately it's something that is becoming more and more of a regular occurrence in the UK, that patients will be presenting at hospitals with these types of injuries. So there is particular guidance around this type of issue. And just looking at the comment there from Vashvi, we're thinking that if a HIV patient refuses to reveal his diagnosis to his partner, who is also a patient at the same GP, then patient confidentiality would have to be breached after consulting partners, multidisciplinary teams, and GMC guidance. So absolutely, in terms of confidentiality, covers a whole variety of different areas, and serious communicable diseases is one of those areas. And again, we've got specific guidance that will help you in terms of making those decisions. But exactly as you say, if you were faced with that situation, you would want to be taking help and support from those around you, not just making that type of decision on your own. Because although the duty of confidentiality is extremely important, there are some exceptions to the duty. And those exceptions are that we might get consent from the patient. So the scenario we've just watched, would anyone just go back and ask Andrew for consent? So you could go to Andrew and you could say, Andrew, there are a couple of police officers in reception and they are looking for somebody who meets your description. Are you happy for me to give the police your information? Who's going to take that approach? Anyone think that's a good idea? So I personally don't think going and asking for consent is the best approach in this scenario. Got to think, if we go and speak to a dangerous criminal and we give them a heads up that the police are there, they may attack you. They may turn around and have a weapon on them, and they may pull a knife on you. Got to think about your own health and safety, and got to put that first, really. So I personally wouldn't be going and asking for patients' consent in this situation. Yeah, exactly. He might get aggressive. We might be giving him a heads up. Best case scenario, he might just run off. Worst case scenario, he pulls a weapon out and he starts threatening you. So as somebody mentioned earlier, the law might tell us that we've got to give the police or anybody else certain information. So the police might turn up with a court order, or they might turn up with a warrant or a judgment, a judge-ordered statement. So in that scenario, we've got to do exactly what the police say, exactly what the law says, and that law applies to us all. So we need to be aware of that, and there are certain laws that apply directly to your role as doctors. If we think about issues around female genital mutilation, so FGM, that is something that if you have concerns about or aware of, then you have a duty to report that. But in this scenario, it doesn't look like the police have got a warrant for his arrest, so there's no law that says we have to share this information. What we are thinking about in this scenario is whether it's in the public interest. And I think Sonali mentioned it above, that there could be wider implications here. So we've got a criminal who's potentially been involved in a violent crime, potentially murdered somebody. Could he potentially be going out and committing more violent crime? Could could this lead to sort of gang attacks, and could there be people looking to carry out revenge on this individual? So got to weigh up whether it's in the public interest for us to share this information. And that is a very difficult decision to make. And what the guidance says is that you shouldn't be making this type of decision on your own. You should be seeking advice from your colleagues. We should be speaking to the legal team at the place which you are working. We should be getting lots of support to make this type of decision, because it's an extremely complex and difficult decision to make. We have a little acronym to help remind us of the exceptions to the duty of confidentiality, and that is CLAPI. So think about clapping your hands together, and we've got consent, law, and public interest. So we're just going to see what the doctor did in this situation and decide if we're happy with how they managed this.
Well, someone has been admitted to A&E with injuries that are consistent with a fight, but I don't think I can release any personal information without a court order or the patient's consent.
You do understand that this is a serious crime, a murder. We need to have the name.
I appreciate the circumstances, but breaching patient confidentiality is a serious step to take.
As is murder.
I need to check with a colleague if I'm going to disclose information without a patient's consent.
Thank you.
So what do we think about how the doctor managed that? I always like that on 2 occasions the police remind you that murder is a serious crime, just in case you'd forgotten that. But what do we think about how the doctor handled that? Are we happy with how that was managed? Yeah, so I think a really good example there of how you can deal with that sort of situation. So you buy yourself a bit of time, you go and speak to your colleagues, and you come back and you give the police an answer when you are ready to give them an answer. You don't get pressured into making a decision in that type of situation. Absolutely remained calm and showed a good understanding of the situation that they were in. So I think a really good example of how you can manage those types of scenarios. So we'll wrap things up now. We're coming to the end. Hopefully in this quick hour or so, we've talked a bit about the role of the GMC, and I've introduced you to the Welcome to UK Practice session, and hopefully given you a taste of what things are like, and encourage you to look at booking on one of those sessions in the future. Just highlight that all of our guidance is on the website, so you can have a look on the website and familiarize yourself with the guidance that is available. As I said right at the start, we have a learning environment on the website where you can look at different case studies, different areas of the guidance, and you can test your own knowledge and understanding. So would there ever be a situation where you have to make a decision on your own? So there certainly will be situations where you're making decisions on your own, but in these types of scenarios where they are particularly complex, there should be colleagues around to support you and make these types of decisions. You should have people on call, should have access to others to support you in this sort of decision-making process. So go onto the website if you would be interested in going on one of these courses, and do have a look on the GMC website. Look at booking yourself a place. If you know any friends who would be interested in coming along, then please do have a look at the website for more information. And then finally, just a big thank you for joining the session this afternoon. Really do appreciate you giving up your time to sit and listen to me, and getting involved in the session is makes it much more enjoyable for me when there's a bit of engagement there. So really do appreciate you getting involved, and hopefully you enjoy the rest of the afternoon or evening as it is approaching now. and best of luck for your future careers. Hopefully I will get to meet you at some point when I'm delivering a face-to-face GMC session, and hopefully in the not so distant future. So thank you very much for your time and enjoy the rest of your day.